with Pippa Hudson in for John Matham
on Cape Talk.
Starting with a subject close to my heart this afternoon, it's World Allergy Week, which is an opportunity to highlight something that plagues me and many other fellow allergy sufferers and plagues us to differing degrees. But whether you suffer from a mild seasonal reaction to pollen or a life-threatening potential anaphylactic response to shellfish, for example, you know that an allergy is something that can have a huge impact on quality of life and one's ability to function normally in daily life. So I was really encouraged to read a report recently suggesting that one of the long prevalent childhood allergies appears to be on the decline, and that is the allergy to peanuts. A paper that was published in the Journal of Pediatrics late last year suggesting that the number of peanut allergies diagnosed in children had dropped something like 40% in the last decade. So I'm intrigued to talk about what has changed and what more we need to know about this story. It's a great pleasure to welcome on the line Dr Thulja Trikamjee, who's the director of the Allergy Foundation of South Africa and somebody with a keen special interest in pediatric allergies. Thulja, welcome to the show. It's great to have you with us.
Good afternoon, Pippa. Good afternoon to the listeners as well. And thank you for having me to highlight World Allergy Week, something very close to all our hearts and yours as well, from what I can tell.
Very much so. Part of my life, my whole life, Thulja. A battle never to be won, I'm afraid. Before we talk about the peanut issue, I think it might be helpful just to set the scene with an explanation in layman's terms about what is actually going on in the body when you have an allergic reaction, whether it's to a food, a substance, or some other trigger. What is the body actually doing that brings on the symptoms we know, like shortness of breath and swelling of the lips and itchy eyes and all the other things that come with it?
So I think that is such an important and extremely misunderstood question. Thank you for asking that. Essentially, in a nutshell, an allergy is when your body, more specifically your immune system, is having an abnormal reaction to something which it ought not react to. Mm-hmm. So if we look in the case of something like a food, because those are generally your more severe reactions, and since we mentioned peanut, we can use that as an example. Yeah. The person who is not allergic to a peanut is going to eat a peanut and be completely fine. But the person who has the allergy to peanut, their immune system, as soon as it comes into contact with the protein from the peanut, is going to mount a response and you're going to have a reaction. So lots of chemicals involved in it. One of the classical ones everybody would know is your histamine chemical, and that then causes inflammation in various parts of your immune system. That could include your eyes, your nose, your throat. This is why a dangerous reaction might involve somebody saying that my throat is closing. I'm feeling a choking sensation. Your lungs closing up, so people saying that I can't breathe, my chest feels tight. Hives on your body, so your skin is involved, largest organ in your body, part of your immune system, red bumps, red hives on your body, swelling around your lips. Classically, we see pictures of these kids all around the world with a big swollen lip or a big swollen tongue. Those are our mucosal parts of our skin that are swelling up as well. And then systemically, your cardiovascular system, your heart rate can go up or down, blood pressure can go up or down. And in severe anaphylaxis, people might even say that they're losing consciousness. And that's when your brain and your central nervous system is involved as well.
So, I mean, it can be life-threatening. And obviously, we know different people react in different ways to different allergens and to different degrees. But the emphasis in this World Allergy Week is to remind everybody listening today that it's potentially life-altering and life-threatening if you have a really severe allergy. Now, Thulja, I'm thinking back to the early 2000s when my kids were born, and the prevailing sort of wisdom at the time was, if you have a family history of allergies, be very careful about introducing potential allergens into the child's diet. I have that family history. I was told no peanut butter, for example. The schools were all peanut-free zones. We weren't allowed to send peanut butter sandwiches to school, even if you weren't allergic. That was the kind of prevailing wisdom. And there was a shift about a decade after that, Thulja, and it looks like that shift has had a quite significant impact on allergy levels. Now, I mentioned at the start of the interview that American research paper published in the Journal of Pediatrics. The drop that they reported, is that just in America, or is that being seen globally and here in South Africa as well, that the number of children suffering from peanut allergies has actually come down?
So unfortunately, we don't have data all around the world, but certainly in developed countries, there has been a drop in the levels. And we are finding that that drop has coincided with the change in the guidelines. And just for the information of the listeners, essentially, you know, what you're describing is what we were all brought up with. If there was a history of allergies in the family, we stay away from it. And the change happened because what we were finding as allergists, the field of allergy relatively in the world, allergy and immunology is a new specialty. It's a new field where we really research allergies down to, you know, the protein and the cellular component of what causes allergies. And what we found was that type of advice wasn't actually helping patients with allergies. In fact, when patients were staying away from things that they were allergic to, or if they were at risk of it, it was actually causing an increase in allergies. And coming back to the immune system, essentially the principle of that is that if you expose an immune system which is growing in a baby when the immune system is still at the development phases, that immune system is more likely to still have antibodies or have some level of tolerance rather than being sensitive. So, you know, in layman's terms, what we want to do is we want to expose kids to allergenic foods, peanut being one of them, earlier rather than later, because what we want to do is we want to train that immune system to be tolerant so that that immune system then is not naive to these proteins. Allergies to foods in general are on the rise. We know that generally speaking. But when these guidelines change with this information that we have, with this whole new realm of what we refer to as allergy prevention, in the developed countries where this now has become standard practice, that has led to a slight decrease in the new peanut allergies that are being diagnosed. So definitely this has played a role in it.
So just to recap, effectively you're saying let the child's immune system meet the potential allergens early on, let it develop the knowledge on what to do with them and how to react or not react, and hopefully that provides protection as they get older. So that's quite it's a 180-degree turnaround from what we used to be told. Thulja, is that message reaching the new parents today? Because how is our communication around this topic? Because it is a radical change. And, you know, so much of our parenting, we do what our parents did before us and what we were told by them. Is the communication around this quite drastic change of approach reaching the parent whose baby is arriving tomorrow, for example?
Yes. So two things there, Pippa. I think the first thing is remembering that in South Africa, because of our Department of Health guidelines being stringent on breastfeeding practices. So one of these new practices of introduction, in our introduction phase, we say it's early introduction of allergenic foods. So when you're looking at things like your milk, your egg, your peanuts, we now are advising moms, and this is what happens in the developed world, certainly with patients of mine in private practice, it's at 4 months rather than 6 months.
Okay.
So one of the reasons why this is not a blanket rule for everybody is that we have to take into account that we are in a developing country. Malnutrition, things like tuberculosis, HIV are still issues in our country, and our National Department of Health guidelines have not changed and will not change anytime soon. But for children who have a risk of a food allergy or have a family risk of atopy or allergy, so asthma, eczema, hay fever, if the child was born with eczema, once the child has been assessed by their pediatrician, has seen an allergist, and we know that there isn't a risk of the child reacting, yes, 100%. We are out there doing talks, we're advocating, and we're explaining to moms that early introduction is better rather than later introduction. Obviously, I don't want all moms to feel that if they're afraid for some reason, or if there's a risk of a reaction, please make sure that you go to your pediatrician or you seek help and you go to an allergy specialist, go to an allergist, so that if there's any risk of your child reacting, that you know that you're doing this in a safe way. Certainly in many parts of the world, when there is a high risk of food allergy, sometimes this early introduction is even done under the supervision of the allergy doctor. So, it's done in the room so that it's safe, because while it's very easy for you and me to know that this is the data, for a mom who's stressed out at home with this baby, to be giving peanut butter, it's not the easiest thing to do, because they're going to be worried about a reaction, and should a reaction happen, what they should do. Yeah. So, early introduction does lead to better tolerance, yes, but each individual needs to be assessed separately. And certainly, if you have no family history and if you know for sure that your baby would or could tolerate this, then do not keep your babies away from it. Do not keep the siblings away from it. Expose, this has been a message that I've been saying for years. Expose, expose, expose. Children growing up in farm environments who do not keep themselves away from things such as, animal exposure, dirt, dust, and even foods generally tend to have stronger immune systems, and that's the whole theory here.
Yeah. Thulja, I mentioned earlier for my kids there was a policy at school of it being a peanut-free zone, and with very good reason, because I do recall there was a child who had a known very severe peanut allergy in one of their classes, and the school's just decision was to protect that child. They would say nobody brings peanut butter sandwiches to school. Is that sort of prevailing wisdom too, or what advice for the group environment who has to manage all sides of the allergy sphere, or both ends of the allergy sphere, if I can put it that way?
So, that falls into the category, firstly, of how badly allergies really affect people, and that's our message at the Allergy Foundation of South Africa and the World Allergy Organization about allergy care being essential care, because we find that often allergies are trivialized. People just think that, if you have an allergy, that it's something where you do a test and then if it's a food, you stay away from it forever, amen. And if it's something in the environment, you just take treatment over the counter when you need to. So when it comes to a food allergy, firstly, it impacts that mom, that father, that family, that child. And what you're describing is how badly it impacts every child in the classroom, how badly it impacts the mothers who are packing lunch for all the other children in that classroom as well. So yes, the first message there is how a food allergy can impact your entire surrounding community, not just that patient struggling with it. But my message to that patient and that patient's mom also is we have so much more data now. We have so much more scientific evidence on how we manage these food allergies. So ensure that you're seeking help and making sure that you're seeing an accredited allergy specialist so that you're doing what we can to reduce the risk of your child having a bad allergy. And yes, there are new modalities that can work in some patients, but also manage the allergy so that we can monitor if this child eventually outgrows the allergy. Allergies in foods are increasing, yes, but another problem that we find globally as allergy specialists is a lot of overestimation of allergies. And to that, Pippa, I'm speaking about a lot of people who might sometimes just get a sore tummy or get a mild rash or get a little bit of diarrhea or vomiting and say, well, I'm pretty sure my child's allergic to milk. And we see that in adults with allergies as well. Or I think it might be the milk. I think it might be the wheat. So making sure that you have a proper robust diagnosis of the allergy is also key in that way. And I think the end key message there is allergies are very serious, to be taken seriously, but at the same time, there's a lot of allergies that are sometimes not properly diagnosed. That proper diagnosis is really essential so that you don't have to go through all of those negative impacts on your quality of life.
Dr. Thulja Trikamjee, thank you so much. Speaking there as Director of the Allergy Foundation of South Africa. And by the way, if you're looking for resources on good information, properly medically vetted information, their website is an excellent resource, allergyfoundation.co.za. Thank you so much, Dr. Trikamjee.